And excellent. Good evening, everyone. I'm so glad that you're joining us here tonight. Very excited to have you. I think you're in for a really good webinar with two of my great colleagues who I've had the good fortune of working with for a good number of years. Just so that you know, we are recording tonight's event. It will be posted on the Parent and Family Resources website on the Office of Student Success Services webpage. So if you want to go back and look at this information, you are welcome to do so. We've got lots of people who are still joining us, but because I value everyone's time, we're going to go ahead and get started. We will be taking questions at the end of the presentation, but I'll be keeping track of the questions that come up in the chat. So please feel free to type your questions or responses, comments right there in your chat. And it is my distinct pleasure to be welcoming tonight our Directors of Health Services, Deb Bello, and our Director of Counseling Services, Jess Jolly. I've worked with both of them for a good number of years now. They are very, very good at what they do. So I'm going to let them I'm going to turn this over to them and I'm going to share my screen so you can see what we're talking about. And there you go. Thanks, everyone. Deb?
Hi, everybody. I'm Deborah Bello. I am the Director of Health Services here at St. Mary's College of Maryland. I'm also a registered nurse of 36 years, and I'm excited to be here with you tonight. Jess?
Yeah. Jess Jolly, Director of Counseling Services. I'm a clinical social worker. I've had different workplace settings, the community, private practice. I've also worked in higher ed as an academic coach. So I love working at St. Mary's. It's a great student population to work with. So I'm very excited to share wellness information with you all tonight. So I'll get started on slide one. So I will be presenting on the first portion, and then Deb will pick it up at the midway point. So I'm actually designing this presentation off of a presentation that I use to present to students. We try and talk about wellness as often as we can get out to student classrooms, workshops, to really reinforce healthy behaviors, coping, and then identifying when it's time to seek help. So I'm going to ask you all, and you could drop it in the chat if you would like to stay on mute, but what is wellness to you when you hear that word? What is wellness to you?
Can you hear me?
Stress
Yes.
management,
Okay, well,
effective.
good evening, everyone. Your question is, what is wellness?
Mhm.
Wellness is just having a very um, straight view of what it means to be mentally and psychologically well,
Mhm.
not just physically, mentally, psychologically, emotionally, to be well, meaning you can, to me, it means meaning you can control your destiny, so to speak. You can control your emotions, or you can navigate yourself in such a way that you can have success. And you don't let the barriers that are in your way cause you to cease to strive for what it is that you want to become, what type of person you want to present yourself as, and so on and so on. So that's my take on it. Of course, that's just my
I really appreciate that response, and it touched on success and knowing yourself and managing your emotions. Yeah, that was really great. Thank you.
You're welcome.
Anyone else? I think I heard someone talk about stress.
Hi, this is Stacy. In the context of school, what came to mind was stress management because I know
Mhm.
courses could become very stressful, especially the more difficult ones. So students being able to understand how to manage that stress, I think, contributes to their well-being and yeah.
Absolutely. And thank you for that response touching on stress because actually I built it into this presentation, but it is a huge part of what influences mental well-being, physical well-being, right? We know that stress exacerbates some mental health symptoms as well as physical ailments. So managing stress is very important, especially in school and a higher ed setting for sure. There's so many demands, especially at an honors college, right? So that is a very important topic. Thank you. Anyone else? I'll check the chat real quick. Jump to the bottom. Oh, I think we're good. So
I
Deb,
was gonna contribute. Sorry, thank you. I also think part of wellness, especially for the college kids of these ages, is self-advocacy and
Mhm.
realizing when something's wrong and it's okay, and there's no shame and there's no fear, whether it's physical, physiological, psychological, emotional, to, come forward because in this world there's a lot of there's a lot going on, and I feel like sometimes these kids are afraid to speak up, and some just taking the courage to self-advocate and saying, this isn't right, I don't feel right, or I think that's a big, piece of it as well.
Yeah, so touching on advocacy, self-advocacy, setting boundaries, having that awareness of sometimes when to say no, when to speak up, huge life skill steps there too that a lot of students learn in this age range, right? So we're talking about traditional college students, although we have non-traditional students, right, who are older, returning students, right? We have veterans. So when I talk about students, a lot of times I'm talking about our traditional age ranges, right? But I don't want to forget there are transfer students, returning students, veterans, folks who are coming back for a degree. So thank you all for your responses. That was very good. Next slide, please. Okay. So I think everyone touched on this definition as we are going around. So I like to use the SAMHSA 8 Dimensions of Wellness definition. And SAMHSA is short for the Substance Abuse and Mental Health Services Administration. Um, Over 10 years ago, they developed a study to determine what wellness was, and they came up with 8 dimensions of wellness. And I'll get into that in the next slide, but they define wellness as having a personal meaning for everyone. And we talked about that earlier, right? Everyone had a varying viewpoint, and that's okay. That's great. Wellness is different for everyone. Um, and it's also referring to an overall state of well-being. It's more than just the absence of disease or stress. It's having a purpose in life, right? So um, maybe there's a career path, maybe there's a club or a passion that a student might have, right? So it's really important to have that purpose or find purpose. Sometimes we don't know, right? But try new things, see if it sticks. Um, Active enjoyment and satisfying work and play. It is important to have fun. Sometimes schedules can be busy. They could, be pretty packed, but it's also important to build in some time for recreation. Joyful relationships, so positive relationships, friends, family, peers, and healthy body, just meaning being well and living environment, safe, nourishing environment. Next slide, please. All right, so there's our 8 dimensions of wellness there. And when you look up this model online, you'll see it as a circular chart, right? Because they're all connected. All these little areas are connected. So emotional meaning your emotional health, environmental meaning the state of your environment. Is it a healthy environment? Does it provide you with the nourishment you need socially? Infrastructure wise, financial, it is part of wellness. Being able to manage finances. Intellectual, that's pursuing things that bring you joy in regards to study or trying a new skill. Social, having a array of people to turn to for support, friends, just different social connections. Physical is just physical wellness, right? And we're not saying, you have to run a mile every day. It's just, are you physically well? Are you taking care of yourself? Spiritual. So this doesn't necessarily have to mean religious. This is just something greater than yourself. sometimes people say, you know what, I like going to the waterfront. That brings me a sense of something beyond myself, right? Or the woods. But it certainly can be a religious experience as well. Occupational, so that's finding joy in your work, finding meaningful work, things you like to do. But, you know, we assess this, and when we're looking at wellness, it's really important to delve into these areas. From a clinical standpoint, when you're assessing someone, you want to look at these factors. We call it the biopsychosocial and then some, right? How's everybody functioning in these varying areas? So just wanted to kind of zoom the lens out and say, hey, here is wellness in its many forms. Next slide, please. All right, so here we are with stress management. So it's very important to manage stress. Um, Stress, could be a state of worry or mental tension caused by a difficult situation, right? We're reacting to a stressor, something happens, we feel the stress and tension in our bodies. But it's natural, and this is what I like to tell students. We are built to be stressed, believe it or not. It goes to our fight or flight instincts, right? It's to keep us safe. We're responding, but too much is not healthy. Too little is also not healthy. There's something called eustress, which helps to motivate us to finish a task. Again, find motivation. So stress is all about management, right? Again, we'll never not have stress, but it's all about what we do with it and how we react. So, um, this is according to the World Health Organization. But yes, how we manage it makes a difference to our overall well-being. Next slide. Okay, so another important aspect of wellness is self-care. And this means taking the time to do things that help you to live well and improve your physical health and mental health, right? So going back to our wellness points there. It can help you manage stress, lower your risk of illness, and increase your energy. Even small acts of self-care in your daily life can have a big impact, and that's according to the National Institutes of Mental Health. One of the workshop activities I love to do with students is to create a self-care plan. So you look at different areas of your life, pretty much going back to that 8 dimension of wellness plan, and you say, what are some things I'd like to do for myself in this area? What are some things I would like to set as a goal emotionally? Maybe it's talking to friends. Maybe it's going to therapy. How about physically? Maybe you want to walk at least 30 minutes a day. So setting goals is also important. Knowing what works for you is important. Again, everyone's different. But it's also important to try out new things. We have a rec center on campus. There's classes that go on all the time. Some students, they ask us, do you have yoga? And I'm like, yes, we do. It's at the Arc. Here are the times, right? So we do have some of these areas just to explore. This is a perfect time in someone's life to explore different options for wellness. Next slide, please. All right. Also important to break things down. So typically, I'd show this image along with this slide where it's a person climbing a ladder. And on one side, you see someone with a ladder, and the rungs are very wide, right? So they're really struggling to get up. And on the other side of the image, there's someone with little rungs, and they're making progress up their little ladder. It's because they're breaking things down into small steps and routines. Oh, thanks, Joanne. You started taking a bar class in Pilates at SMCM. It all started there. There you go. So that's another area to explore if you have a student who's looking to try some of those classes. So set. I'm sorry. All right. Set your goals and priorities, decide what must get done now and what can wait, right? So that's prioritizing. This is something OS3 can help with 100%. They are great to help your student learn how to prioritize and organize. Because sometimes we come into college and we haven't learned these skills. This is a perfect time to get support. Learn how to say no. Mentioned that earlier, right? Taking on new tasks. Look at what's on your plate. This is something that commonly happens. where there's so many opportunity, right? There's so many things to do, and a student can overload themselves very quickly, and that creates stress, right? And then trying to meet this demand and that demand. So it's really important to step back, and I encourage look at your schedule. What do you have built in there? So you might have your classes. How much time do you need to complete your schoolwork? Let's look at that. Yep. And so OS3 can help students manage their workload, time, and stress. Absolutely. And I always encourage, after you look at what you're building into your day, right? It's more than just classes. What time are you leaving for yourself? What time are you building in for self-care? And and then I encourage, put a line around that. That is yours, and that is not to give away to any other demand. You know, that's something for you. Leave yourself some time during the day. So if you want to relax, if you want to listen to music, if you want to spend time with friends, yep, sleep management, OS3 helps with that as well. And I get into sleep a little bit later, because actually college students in that age range, the traditional college student age range, they have the highest numbers of deficit for sleep uh, in the general population. So yeah, sleep is very important. Another thing, when you are setting goals, be mindful of what you have accomplished at the end of the day, not what you're unable to do. Reflect on the accomplishments, the positives. Very important for learning reinforcement. We learn by positive things, right? So think about all those good things at the end of the day. All right, next slide, please. So this goes into healthy eating, exercise. We also call it healthy movement. So healthy movement could include 30 minutes of walking, moving a day, right? Swimming, whatever the choice is. It adds up. So if you can't do 30 minutes at a time, sometimes I say, look, you walk to class. That's awesome. How long do you think that walk was? Did you go from Anne Arundel Hall all the way to Good Pasture? Um, so count those milestones. Regular eating, exercise paired with exercise, right? Staying hydrated. I see a lot more students with water bottles now. That's awesome. They are hydrating. It's so important. Also, limiting those caffeinated beverages is also important. So, I also want to take a moment to let parents know Bon Appetit, who is our contract service provider, has a dietitian that will see your student and provide a consultation for free via Zoom. And we do have some resources available on the health services website and then the counseling services website. But sometimes that could be very overwhelming. Going to college, here's all these food choices. What's best for me? What's going to give me energy? Her name's Danielle, and she, yep, is very happy to meet with students to talk about that. So that's a resource that I can pass along. Next slide, please. Does a dietitian have expertise with athletes? I am not certain off the top of my head, but I believe we do have her contact listed. And then if Joanna, is there opportunity if we do some follow-ups, we could send you some information to pass along?
Sure. That would be fine.
Okay, great. That's a good question. All right, here's sleep. Setting a sleep schedule. Avoiding those blue lights from devices. It can make it harder to fall asleep. Limit exposure from computers before bedtime. There's also a lot of resources these days for relaxation. There's apps to help people do some self-soothing, some relaxation techniques, breathing exercises. So I think the key is setting that schedule, when setting a bedtime, setting our own bedtime, right? Is definitely a wellness life skill that can start in college. Next slide, please. All right, so accessing support is also really important. So staying connected, reaching out to family members and friends who can provide emotional support. So we did an assessment called the Healthy Mind Survey. We just did our second round. It's a national study on wellness on our campus. And it was found, oh, Danielle Rosner loves working with athletes. Thank you, Deb. So there's an answer. Thank you. So, oh, there's Joanne's email in the chat as well. And I just got distracted. Let me get back to that slide there. Oh, so it's found that students will reach out to family members and friends first before they seek professional help, right? So, um, it's likely that, students will start with people they know, who they trust, before turning to professionals. And that's pretty normal, honestly. To seek professional support, this is important when there's emotional struggles, things become overwhelming. Um, the the timeline that's usually recommended is if it's lasting 2 weeks or more, right? If it's continuing in a pattern, it's really important to seek help. It's interfering with the daily functioning. There's hopelessness. There's some risk taking, maybe some social withdrawal. Maybe the student is not leaving the room, going to class. Maybe there's some self-injury, suicidal thoughts. So that is definitely time to seek professional support. And I'll get into those supports as we go on as well. Next slide, please. All right. So let me give you some tips from the JED Foundation. This is the organization we've been working with to help improve wellness on campus. You can find information on our website at smcm.edu/JED. But just some tips for caregivers and families. Just know it's natural to have stress when adjusting to college. It is a big step, so there will be some stress. But know the signs, and the stress is unusually intense. Who to reach out to on campus? So we have our resources here. Support your student in transitioning their mental health care and make a plan. So if they already see someone, you might want to encourage, here's when you'll meet with your therapist. Do you have access to a place to do that? So both the health center and the counseling center have a Zoom room where students can sign out time to speak to professional, right? To go on Zoom or whatever platform they use. Medications is another one, how much medication to take, how to get your medication while you're on campus. We do have the campus bus now, and there's also some delivery from a local pharmacy that Deb can get more into, but there are ways to access that. But these are all things to consider for mental health and who to go to for crisis. Next slide. All right, and talking to your student about the importance of taking a larger responsibility for their health over time, including their mental health. So that's a big step, right? Some students have never scheduled an appointment before, and this is a time to try that out. And I think it's a huge step. So I give them a lot of kudos for the folks who try it out for the first time. Make sure your student knows about their health insurance coverage and how it works. Now, both health and counseling, overall, generally, it is covered by student fees. There are some exceptions. Deb can get into the health services side, but for us, everything is covered by student fees with the exception of the medication that the nurse practitioner prescribes. So they don't have to worry about some components of health insurance. But if they go off campus to like a off-campus provider for counseling or an urgent care, they might need to know how to use that insurance, co-pays, all that stuff. So, all right, next slide. If your student has a mental health condition, discuss their early warning signs that the mental illness is flaring up. So that's part of planning. I do some crisis planning. Actually, throughout my career, I've done that with clients, but it's important to know your early warning signs, knowing when things are starting to occur and what to do about it. Consider check-ins with your student. Hey, if you're feeling this way, give me a call. Let's talk about it. Because sometimes when you're in that mindset, it's really hard to think through it. It's important to get feedback from people who care and are trusted. Talk about what you see as the best role for you in their healthcare and become familiar with resources, right? So talk about what might work best. When when would they need to maybe go home for the weekend, right? Are there some increments you can schedule in just to check in with the family? So this is just some overall tips. I'm sure there's many more, but let's go to the next slide. This is counseling services. So this is an overview of our services at the counseling services building, which is right next to Campus Center. There's our website, smcm.edu/counseling. We're open Monday through Friday, 8 a.m. to 5 p.m., and we have a 24-hour helpline. Students can call this line at 3 o'clock in the morning and talk to a trained professional. Next slide, please. All right, so we are staffed by a team of licensed mental health professionals who assist with addressing mental health needs through different modalities and clinical orientations. So we have an art therapist, we have folks who could do all kinds of supportive therapy. So it's everyone has a little different approach, but we all work together as a team. Next slide, please. Our sessions are bi-weekly and they're spread throughout the academic semester, but we also have walk-in and urgent appointments available. If a student really needs to talk to someone, we will assess and make sure that they could be seen. Next slide. So psychiatric services are available for those who are looking to enroll in medication management. We have a nurse practitioner, psychiatric nurse practitioner. She's virtual Tuesdays and Thursdays. And a student must meet with a therapist at least once a month to receive those services. She works with off-campus counselors. It's just best practice to have a counselor working on those coping skills alongside the medication management. We actually expanded this semester from 10 a.m. to 3 p.m. Just didn't get around to updating that. So she has some increased availability this semester. Next slide. We also have peer health educators. These are students who are trained in peer counseling. They are available during walk-in hours. They will meet with students who are appropriate as far as their circumstances. So it could be roommate issues, accessing resources, just some stress management kind of situations. But students who need a higher level of care, we assess and triage, and they see a licensed counselor. But they also raise awareness on campus around issues of mental and physical wellness, alcohol and drug prevention, suicide prevention, depression and anxiety, sexual health, safety. So they're really out there getting information out to students. And sometimes it's better that they do that because it's found that peers will trust peers more than professionals sometimes. All right, next slide. Right. We also do some group therapies. So this could be anywhere from adjusting to college, body image, toxic relationships, mindfulness, grief, substance use, neurodiversity, depression, self-esteem, and art therapy. Currently, we're running a grief support group with art therapy. So we do have that running this semester. And if you have questions about that, our email was in that first slide. Next slide. And I talked about the Zoom room. We also have a calm room. Sometimes they're called meditation rooms. Students can reserve a space. They can just kind of sit, chill. There's some instructions on how to do relaxation skills. We have a sun lamp in there for students who are affected by seasonal affective disorders. They could turn on the sun lamp and sit under that. And it provides a confidential space outside of residence halls. Next slide. All right. Case management. So we are working with a company called WellTrack. We build a network of professionals off sites across Maryland. You can actually find a clinician across the country that takes certain criteria that the student might be looking for, like their insurance type, even somebody in their hometown. But we have these referrals available if students are looking for off-campus providers. So case management is most appropriate for students who are not in immediate crisis. And the referral is not specifically like a mental health issue, like they need to be seen then, right? So, and then we also have Southern Maryland Center for Family Advocacy, which is a organization that works with domestic violence and sexual assault survivors. So we also refer to that organization off campus as well. Next slide. All right. Turn it over to Deb. Thank you.
All right. Thanks, Jess. That was a lot of great information. All right. So, as the slide says, I'm Deborah Bello, and I'm the Director of Health Services here. Next slide, Julian. And here is our location, our contact information, our hours of operation. We are open Monday through Friday, 8 to 5. We do take a lunch break. But it's important to note that we're not open when the college is closed for holidays and breaks. Okay, and anytime there's something like that happening where we're closed, like recently because of the weather, we'll always put a notification on our social media Instagram page. We find that that's the best way to reach students. Okay, since you're going to get these slides, I'm not going to read you the address and things like that. All right, so our clinic is staffed by a team of licensed healthcare professionals who assist students in addressing their health needs through various treatments and interventions and programming efforts across the campus community. Next slide, Joey. So in our prior slides, we did have our pictures. So I'll let you also know that we have a nurse practitioner. Her name is Mary Wentz, and she's here every day. Amber Verbeck is our assistant director, and she's a registered nurse. She's here every day as well. We have an office associate or medical receptionist. And then there's myself, who's the director, and I'm also a registered nurse. All right, so our mission is to deliver individualized medical care while promoting patient advocacy and health education to the students. We equip students with the knowledge and skills needed to navigate the healthcare system, which, as we know, is getting more difficult. It's hard for even us as healthcare providers sometimes to navigate it. So I can't imagine what it might feel like to be a student and you're just kind of dropped here and you don't even know what your insurance card means. But that being said, we want to help them to make informed, lifelong, healthy choices. And I think it was maybe Tina who had mentioned this piece already about like self-advocacy. So, we're very much aware that this is needed for of our students. They need us to kind of show them like this is the way. One of the questions that we oftentimes ask students once we give them a bunch of information is what do you think your next steps are going to be? So we're not always just telling them what to do. We're kind of assessing that they're taking in what we're saying and that they're kind of formulating a plan too. Okay, so our next mission is that our work centers on empowering all students to thrive, and by prioritizing physical, mental, and social well-being, just like Jess said, we support academic success by just promoting a healthier, more fulfilling, lifestyle. Alrighty, next slide, Joanne. Alrighty. I'm going to go ahead and just for the sake of time and just to let you guys know that our mission aligns with the Healthy People 2030, which is a national initiative led by the U.S. Department of Health and Human Services, which establishes science-based objectives to improve the health and well-being of people across the United States. Next slide. Okay, so what do we do? Let's get into the nitty-gritty of it. There's lots of things that we do here. Most importantly is to mention that, there are no student fees and there's no fees for our students. The only reason we would ask for their insurance card is if we were to utilize a third-party lab like LabCorp. Everybody's probably familiar with that. We will submit a copy of that insurance card if they have insurance to the lab, but that's it. You know, there's no copays, there's no fees or anything like that. And so start with the clinical care. We work by appointments. So a student may have an appointment with the nurse practitioner, the RN, or the certified nurse assistant, depending on what they're coming in for. So an example of a nurse practitioner appointment would be, I think I have a sinus infection and I need an antibiotic. An RN only appointment is, you know, maybe somebody just wants to come in and talk to the nurse about whatever's going on in their life, or they're having some weird symptoms, or maybe they're just coming in because they're getting a weekly injection of something. So that would be like an RN only appointment. And then the certified nurse assistant appointment would be like perhaps a student is just coming in for regular blood pressure checks. And so that would be a nurse assistant appointment. Or sometimes even if a student is seeing a provider on the outside, let's say an endocrinologist, and maybe they're, you know, every other month having their thyroid level checked, and they have an order for a lab. Instead of your student trying to find their way to a LabCorp drawing station, we can do that for them here and send it off to the lab. Okay, so those are some examples of why an appointment would be with a different provider. We will also do sports physicals. But just know if you have an athlete that it is the expectation of the athletic department that they are done and handed in before they come to school. But we are here to do those sports physicals that slip through the cracks. You know, so if you have an athlete, make sure that they are in compliance with what the athletic department is telling them that they need. They have their own little healthcare record keeping system, and our two systems don't talk. Okay, and so we also have, just like Jess mentioned, we have a telehealth suite. What is a telehealth suite? Well, a lot of students are connected with providers in their hometown. Again, I gave you the endocrinologist example, or maybe they have a therapist, you know, in Reisterstown, you know, and so this is yet another quiet space that they can, if it's something regular, they can get on our book so that that room is always available to them. But if it's not being used, something pops up, they can walk in and also use the room. We also have a reproductive health suite, and then in addition to that, 3 more patient examination rooms. All right, going down to lab testing, testing in labs. So we do these, what we call point of care tests, which are those quick 5-10 minute tests. Like if you go to urgent care and they swab your throat, or they do a flu test, and you know, in a very short amount of time, you get the results. We have a ton of those tests. We can do rapid testing for strep, COVID, flu, pregnancy, mono, hemoglobin, hematocrit, urinalysis, blood glucose, amongst some other things, which is really nice because then that helps guide the nurse practitioner's care, plan of care for your student. We already talked about the outside lab, the third-party lab, LabCorp, and that your insurance is billed and or sometimes we will have some self-pay. And so we do have the ability within the LabCorp website to go in and say, okay, if you know my student athlete did their sports physical, but they didn't do the sickle cell test, you know, we can enter that code, and we can then tell your student, okay, if you don't have insurance, this is going to cost $89. You'll get an $89 bill from LabCorp. All right, next slide, Joanne, please. All right, so we have a small pharmacy here for our use. So if our nurse practitioner orders, you know, amoxicillin for that sinus infection, we will dispense the whole prescription to them. What we don't do is we don't fill outside prescriptions, okay, because we're not CVS. We just keep a small supply of what we most commonly prescribe for students. Okay, no charge. So it's really nice that we're able to do that. And that really helps students who they're here without a vehicle or have limited funds to always get a paper prescription. Not that we don't write paper prescriptions, but it's fairly infrequently that we have to do that. Okay. We also have a safe medication disposal and needle exchange program. So if you have a student who's doing some type of injection on their own, we provide needle boxes. Bring us your full one, we give you a brand new one. If students are, instead of having a bunch of expired medications, they can bring them here. We'll take care of that for them. We also provide the Narcan across campus. I think I put up 27 locations where they can grab Narcan. They can also come in and just request it and receive it for free if they want to have it in their backpack or whatever. Also, over-the-counter medications and first aid supplies, that's really important. We have what's called a self-care clinic. And so if students don't need an appointment, let's say they just have some mild cold symptoms, they can just walk in. We have a little shopping list. They just check off coughs or Tylenol, whatever they need. And we give them a little goodie bag to go. So again, no charge, and they don't need an appointment for that. We also, just like counseling services, we do community referrals and consultations. We also have specialty clinics that we will do. So like we will have for like an entire month, for example, we'll have like Diabetes Awareness Month, or like this month is Heart Health Month. And so students can make these kind of concierge appointments with a nurse practitioner where she spends extended amount of time with them. And like I said, today, this month is Heart Health Month. So like they'll come in, they will have a physical assessment, vital signs. We have an EKG machine. We'll do an EKG and just really talk to them about, heart healthy strategies to set them up for success in life. Let's see, what was another one? Diabetes. We 1 month we did a month of stress awareness, and we always give them a little goodie bag too, because students like free stuff. I mean, I like free stuff, so we always, try to give them a little goodie bag to go. We do contraception, emergency contraception, and STI counseling, evaluation. We do have this year is a reproductive health care suite. So because we understand that when you're needing a checkup from here down, for everybody can be a little intimidating the first time that happens. And so we have a very nice, private, very comfortable suite for students to do that. And I really enjoyed over the summer building that for them. Okay, next slide. Okay, now first of all, before I say this, what I read you on that other slide, those are just little highlights. I mean, we have a list of services from here to here and things we do. We really try to keep students here on campus as much as possible. We will even do like IV hydration, anything so that they don't have to go out into town. Of course, we do know our limits, but if we can help here, we will. Services that we can't provide is we don't do allergy shots. And I know that this is upsetting to some people, but this is the second time I've worked here, and I did allergy shots here for 6 years. And I can tell you that it's, for such a small staff, it's really not safe to do it. We just don't have enough resources. And we're also, we would be dealing with providers all across the country, and we just can't do that. So we have some great referrals we can give folks if they need to get their allergy shots out in town. We don't make house calls. So if you call, we can't leave the clinic and go check on your student. If you're really concerned about their welfare, we'll have you contact public safety to check on them. And if they're here living independently at school, they can't come here every day for us to dispense their medication to them and to make sure that they swallow it. We can't do that. So if you have any questions about any of these things we can't do, we can talk about it. You can contact me, give you other resources, and we have workarounds for all of these things. Okay, next slide. Joanne, are the hyperlinks going to work when they get a copy of the slides or access them?
I certainly hope so.
Okay, because like where it says new student forms I had, if you hover over that, does that work, Joanne? Does it, if you click on a new student forms?
That's not hyperlinked in uh the slide deck. If you want to add that hyperlink tomorrow, we can do that.
Okay, yeah, because the slide deck that I handed over did have the hyperlinks worked, but we can put them back in. Okay, so again, the medical insurance, students are, this is a big question, students are not required to purchase health insurance. I know that some schools do require it, but we don't. Now, the students who have to have it, there are some varsity athletes that have to have insurance and international students, but the general population is not required to have it or to purchase it from us. So therefore, we don't endorse any specific health insurance programs. And again, we'll have to add those links back in. But there was a link that I had provided to the St. Mary's County Health Department and the Maryland Health Connections for more information about health insurance. All right. And then here's a QR code, and then the hyperlink will be in that Maryland Health Connection title for more information about what we just talked about. And then next slide. All right, so really the simplest way for a student to make an appointment is just a call. Yes, they can just walk in and we will make them an appointment, but it's probably quicker if they just call. Typically, we see students on the same day or within 24 hours. And unless there's like a run of flu, they might have to wait a little bit longer, but for the most part, it's typically same day. How can a student pick up medications if they don't have transportation? So we already talked about that we try to prescribe them what we have in-house so that they don't have to go anywhere. However, sometimes they have a paper prescription that they need to take to a local pharmacy. So for those situations, we tell students, think about this ahead of time, have a plan in place. If you're coming here without a vehicle, immediately make friends with 3 people who drive and always have a little gas money. I think our generation always knew the beauty of having a little bit of gas money to offer somebody to take you somewhere. We didn't have Ubers and things like that. We just had the $5 shoved somewhere so that you could always give somebody a few bucks, right? So there are Uber services here, but we know that that's costly. The other option is that we have this great local pharmacy called the Pharmacy at the PJ Bean building. If a student lets us know that they want their prescription delivered to campus, we'll fax their prescription over there for them. They just have to they have to go to that website, set up the account, and then David, the driver, will come and to our clinic parking lot and meet them and bring it to them. They don't charge, of course, they charge, their insurance for the prescription, but they don't add on a delivery fee. And this is a good option too if students are on daily medication and, to get you, their parent or guardian, out of the habit of getting it filled, up in Pasadena and then popping it in the mail for them. You can have your CVS pharmacy or whatever your pharmacy is up there, like transfer the prescription to this pharmacy, and then they can do regular deliveries here to get it to them. All right, next slide, Julianne. All right, this is a biggie. Will a parent or guardian be notified if there's a medical or mental health emergency? So we will, if a student comes into our clinic and they're experiencing an emergency, we will contact the student's person who they list on our form, which is called the demographic and consent form. Some of you may remember that from helping your students fill out these forms. Now, if the student is alert and they've got, their cell phone and they're like, I'm telling my mom right now. Yeah, mom, like that's fine. But rest assured, if we're sending them to the hospital and they can't notify you, we'll be calling you if you're the person on this form. Okay, now there's a caveat to that. They may have listed somebody else in residence life as their emergency contact. Or they, so different areas ask for this emergency contact. It's not necessarily the same. So, and I can understand how that would be confusing if to be a parent, like, okay, well, I know residence life, they have me as their emergency contact. Why didn't the clinic call? Well, for some reason your student listed somebody else different. So, but that being said, as long as that form is filled out, you don't need an additional release of information form or ROI form, and you don't need your lawyer to draw up something. As long as that form is filled out, we'll be notifying you if you're the emergency contact. All right, next. And then how can a student access care outside of the clinic hours? Because like I said, we have a small staff. We're powerful and mighty, and have about 6,000 points of patient contact with students annually. But we don't live here, and we understand that there's sometimes our healthcare needs that pop up after hours. So we tell students, if you have something going on that you feel just can't wait until the next day that the clinic opens, or can't wait if it's a weekend and it can't wait for Monday, we have about 4 local urgent care centers. We have those listed on our website. And also, and again, if it's an emergency, they should just call 911. And then we also have a great public safety department who they're here 24/7. They're kind of the adults on duty. They all have training and first aid and CPR. And they have a scanner. So if a student calls an ambulance, they're hearing it and they're going to show up, even probably before the ambulance gets there. But they're also a wonderful resource if students just need to, like, if they're undecided, like, should I go to the hospital? Should I go to urgent care? They're a great resource as well. All right, next slide, Joanne. All right. Let's see. Can the clinic write notes? This is another big one. Can the clinic write notes excusing students for missing class? And Joanne knows all about this. So we do not issue excuse notes, and we try to be really careful about what we do give them about, labeling it correctly. We don't give them excuse notes for class absences. But during a clinic visit, the clinician, Mary, may provide documentation outlining when it's likely safe for a student to return to in-person learning following an infectious illness or an injury. And then students may choose to share this information with employers or appropriate offices or instructors. But regarding missing class, they should refer to the student handbook for the attendance policy. All right. And then do we at the clinic make transportation arrangements for them for medical appointments? We don't. We can certainly help students connect with specialists in the areas, but we don't provide that transportation or arrange it. However, just like I said before, students should plan ahead by asking a friend or a roommate for a ride, utilize Uber or similar taxi services. Or if there's enough notice, they can request transportation by emailing that email address. They do have some student drivers that are available. And so, but the more notice, obviously, they have, the more they have a chance of getting that arranged. So what's not going to work is if a student says, oh, I have an appointment, with the orthopedist in Leonardtown at 4 o'clock. Can you help me? And it's 3 o'clock. Like, that's not going to work. So the sooner in advance that they can request a student driver to pick them up and bring them back to the college, the better. And that is the email address for that. All right, next. There's that pharmacy. Again, we'll get those links to you if those aren't working. And they have a great website. And then there's our website as well. And And there's our Instagram page. Again, when we are next week, for instance, we're doing the blood drive. We have all kinds of information about the blood drive on there, about our specialty clinic, closings. Um, it's kind of a humorous site because I don't know social media, but I'm doing the social media. And so my adult children are always like, Mom, you need to work on, you need to take that down. You can do better. So, so it is fun. But that's our what is it, Jess? Our handle, our link. Um, and
I
I
think it
think that's
takes you right to it. Yeah.
yeah. All right. And then is that it, Jillian? Oh, okay. Oh, here are some pictures. Okay. So we these are just some examples of some programming and community outreach. So like that's me in the first picture with Lolita who works with Jess. And we were doing the self-care table at our Earth Day event. And then we had the St. Mary's County Local Health Department was there, and there was some little cutie pie students there. All right, what you got next, Joanne? And then, oh, well, there, I think that's you, Joanne.
Yes, inviting everyone to, thank you very much, Deb. Inviting everyone to our next two webinars that we'll be doing for the parents and families. 1 month from today, on Tuesday, March 10th, International Education will be presenting. And then on April 14th, my colleague Patrice Darby and I will be presenting to help you prepare for summer with your student at home, as well as preparing for next year. So hopefully you will join us for that. We do have a couple of questions that have come in, Deb. One of them is, what's the cost for doing a physical on campus?
Zero.
See, there are free things in life.
And the
Um,
other thing that's good to mention too is that there's no cap on how many times they come here. They can come here as many times as they need to.
Thank you. We've got several people who are speaking very nicely about the PJ Bean Pharmacy, that they've been very helpful, that they deliver to campus. They're amazing. They are aces. The question, if there is a high rate of infections, for example, flu or mono happening on campus, does an announcement or alert go out to the students?
That's a great question. So we put all kinds of information when we are noticing trends, we will put in information on inside SMCM and Julian, what is the student version of that? That's called the current, right? Is it the
Yes.
current? On Instagram. And then as far as the college goes, they typically will put out information if we're meeting the health department criteria for outbreaks. Um, and also if we get any bulletins or alerts from the health department, we will also pass that along. There's certain things I can directly post and other things that have to go through college administration to do it like an all campus or all community member email alert. And
Question.
we have had in past years when we're at the peak of COVID, several outbreaks and that we had to notify the health department and get everybody involved. So yes, we are always watching trends. Thank you.
Question, did students get a similar overview of what services are available to them?
Yes. So we start an orientation from day one, and a lot of the information we take into different classes, um, lead classes, for example. And like different student groups have the opportunity to tour our buildings. So the D'Souza Brent Scholars, for example, they do tours. So RAs get information. So we really try and meet students on different levels for information.
Thank you. Reggie Marbury, you've got your hand raised. How about unmuting yourself?
Thank you. It's actually Reggie Marbury's wife, but
There you go.
but this was great. Thank you so much for the information. I actually have an older student. He's a sophomore now, but I've literally been texting with him doing this presentation. Did you know this? Did you know that? And he's sometimes like, oh my goodness, I didn't know. I'm going to check it out. So um, just really appreciate the reminders you've given. Very helpful. One of the things I wanted to ask, St. Mary's is so diverse, and you touched on a lot of what you do, but I'm in particular worried about, do you find that there's reluctance amongst, young men to access the services or maybe older students? And are you doing things to sort of make sure that all the population sort of access the services because they're so great? But again, speaking just as a boy mom, it's always a struggle to sort of encourage them to take advantage of services like this. So do you do sort of specialized outreach or work with, maybe the varsity teams or other things to make sure students are using the services?
Great question.
I'll jump in. So like Jess was alluding to just a couple minutes ago, we do tons of outreach, tons of orientations. We get invited to classrooms to share our presentation about services. It almost to the point of where we've kind of lost track of how many times, we give our presentation because it's quite often. Um, and then, oh, there was something else. I just lost my train of thought. It'll pop back to me in a second.
Boys.
Boys, it was about boys. Uh,
It'll come back, but
I'll have to pop back in. I'm sorry. It's just this decade of my life. It'll pop back in a second.
um, we have a comment here about it's very reassuring to know that students have so many wellness resources when they're so far from home. Yes, it is very reassuring. We would like all of our students to make good use of all the resources we have on campus. So help us to help them by passing this information on to them. That would be great. Do we have any other questions? I know we are just a little bit over time, but if you would like to stay on, you are welcome to do so. We will stay on here for a few more moments. If not, thank you again for joining us tonight, folks. We appreciate it very much. The slide deck and the recording will be posted on the Parent and Family Resources website in just a few days, with the links included on the slide deck. So thank you, Jess and Deb, for spending some quality time with us tonight and sharing some really useful information with the parents and family members. Greatly appreciate you.
Sure. And Joanne, I remember what I was going to say.
Excellent.
So the athletes, we work really closely with the athletic trainers. Um, and especially Mary, our nurse practitioner. And the other thing that we also do is the nurses have a program called Ask a Nurse where they kind of do walking rounds where they visit the dorms or sorry, excuse me, the residence halls, and they talk about our services, and it's a Q&A, and it's wildly popular. So they actually get out right into where they live and give them information about our scope of care. That was what I was trying to remember. Thank you.
Excellent. Thank you, folks. Have a very good evening, and we look forward to seeing you hopefully next month and in
Thank you all
April.
so much. It was so informative. Thank you.
Thank
Thank
you.
you.
Thanks, folks.